licensing treatments and vaccines to large and small producers. And fifth, promoting open innovation models and technology transfer that increase local manufacturing and supply capacity. Through CTAP, we're inviting companies or governments that develop an effective therapeutic to contribute the patent to the medicines patent pool, which would then sub-license the patent to generic manufacturers. CTAP is voluntary and builds on the success of the medicines patent pool in expanding access to treatments for HIV and hepatitis C. WHO recognizes the important role that patents play in fueling innovation. But this is a time when people must take priority. Tools to prevent, detect, and treat COVID-19 are global public goods that must be accessible by all people. Science is giving us solutions, but to make the solutions work for everyone, we need solidarity. COVID-19 has highlighted the inequalities of our world, but it's also offering us an opportunity to bring those inequalities and build a fairer world, a world in which health is not a privilege for the few, but a common good. Now, it gives me enormous pleasure to introduce His Excellency Carlos Alvarado, the President of Costa Rica. Muchas gracias, Presidente Alvarado, mi hermano. Mucho gusto por su liderazgo.
Thank you very much.
Thank you. Muchas gracias. I think it's muted.
Okay.
Hannah, can you?
Mi hermano, can you hear me? Gracias, Dr. Tedros, mi hermano,
Thank
my
you,
brother.
Dr. Tedros.
Un saludo.
My greetings.
Para Costa Rica es un honor
Costa Rica,
ser
it is
parte
an
de
honor
una acción colectiva
to be
que
part
envía un
of
mensaje potente a
this
toda la
joint
humanidad
work, which will
sobre las
send
cosas
a strong
maravillosas
message
que
to all of
podemos
humanity
y
of the
somos
wonderful
capaces
things
de
that we can
impulsar en
do and we are
conjunto
capable
para el
of
resguardo del
bringing about
bienestar
together
de todas las
to
personas.
care for the well-being of all.
Hoy se trata de hacer un llamado a la
I'd like
esperanza,
to
sobre
call
todo para las personas más vulnerables en las
hope, particularly for
distintas
the most
partes del
vulnerable
mundo.
people throughout the
Hoy,
world.
líderes estatales,
Today,
altos representantes de organismos
leaders of states and high
multilaterales, del sector
representatives of
privado, de la
multilateral
academia y de la
organizations
sociedad civil,
from academia
unimos
and
voces
social
para
and
anunciar
civil
que
society
hemos
are
asumido
joining
un compromiso
to say
solidario
that we have
por la
made
vida,
a
la dignidad humana y la
commitment of
cooperación
solidarity to
internacional.
work for
La
human
pandemia de
dignity and
COVID-19
international
marcará
solidarity.
un
The
antes y un después en la
COVID-19
historia de la humanidad.
pandemic will show
solo
a
por lo
before
que ha
and an
significado
after
para nuestros
in the
sistemas de
history of
salud
humanity,
y para
not
la
only in terms
convivencia
of our
y
healthcare
relacionamiento
systems,
entre
but also
personas,
for
sino
working
también
together and
porque,
for
a pesar
relationships
de la
between
crisis que
people.
hemos tenido que
Because
enfrentar,
despite the
tenemos
crisis
la
we've had to face,
oportunidad
we
de
have
tomar
an
decisiones
opportunity to
conjuntas
take
que
joint
cambien
decisions
para bien
which will
el
change
futuro de la
for good
población
the
mundial
future
en
of
el
the
corto
world
y mediano plazo.
population in the short and medium.
Se presenta ante nosotros el desafío de toda
So
una
we
vida,
have a challenge of a
garantizar el
lifetime
acceso
to guarantee
universal a
universal
las
access
tecnologías
to
sanitarias que
health
requerimos para hacer
technologies
frente
that we
al
need to
COVID-19.
face
La
COVID-19.
promesa de descubrimientos
The
científicos
promise
seguros,
of
efectivos
sure
y
and
asequibles,
safe and
como
effective
tratamientos y
affordable
medicamentos,
healthcare
vacunas,
solutions
debe
such
ser
as
el vehículo
treatments
que
And
oriente nuestras
vaccines
acciones
must
y
be
nos
the
permita
guide for our
sobrellevar
actions, and it will
una
allow
crisis
us
que
to
ha dejado
overcome a
tanto dolor
crisis
en
which has
tantas
left behind
comunidades
so much
alrededor del
pain
orbe.
in so many
Sin
communities throughout the
embargo,
world.
de nada nos sirve
Nevertheless,
alcanzar
there
estos
is no point in
increíbles desarrollos
achieving these
tecnológicos si
amazing
no podemos
technological
garantizar
developments if
el
we cannot
acceso
guarantee
asequible a las
affordable
tecnologías.
access to technology.
Al inicio de la pandemia,
At the beginning of the
solicité al doctor
pandemic,
general de
I
la
called
OMS,
on
mi
the
estimado
Director
amigo y
General
hermano,
of
el
the
doctor
WHO,
Tedros
my dear
Adhanom
friend, Dr.
Ghebreyesus,
Tedros,
que construyéramos juntos un
help us
mecanismo que
build
nos
together
permitiera
a
poner a
mechanism that
disposición
would
de
help
todos los
us to make
estados del
available
mundo
to all
las
states
tecnologías en
throughout the
salud
world
que
the
se
healthcare
desarrollen
technologies
en la
that will be
lucha
developed
contra el
in the
virus y la
fight
enfermedad que
against
ocasiona.
this virus and
Durante
the
las últimas
disease it
semanas,
brings.
el esfuerzo conjunto
In recent
nos ha
weeks, this
permitido
joint
construir
effort
este
has helped
llamado
us to
solidario de
put
acción,
together this
mediante el cual tendremos
call
una
for
plataforma para
solidarity and
compartir
action
de manera
to give us a
abierta,
platform so we can
voluntaria
share
y
openly on a
colaborativa
voluntary
el
basis and in a
conocimiento, los
collaborative way
datos y la
the
propiedad
data
intelectual
and the
que se
intellectual
genere
property
alrededor
that
del
will be
mundo,
generated
convirtiéndola
throughout
en
the
un
world
bien
in order to make it
público global,
a public
un bien público global.
global good.
Durante la Asamblea Mundial de la
During
Salud
the
número
World Health
73,
Assembly,
realizada
the
de manera
73rd
innovadora
WHA,
hace tan solo
which
2
was held
semanas,
in such an
muchos
innovative
Estados
manner
miembros de la Organización
recently,
Mundial de la
the
Salud
member states
alzaron la
of
voz
the World Health
y
Organization
respaldaron
raised their
el
voices
desarrollo de
and
esta
supported
iniciativa,
the development
la
of
cual
this initiative,
permitirá
and
que
it will
todos los
allow
países tengamos
all
acceso a las
countries to have
soluciones que
access
nos
to
permitan
solutions
protegernos
which will
entre
help us
todos,
protect us,
asegurándonos de no dejar
protect
a
ourselves,
nadie
and to ensure
atrás.
that we leave nobody
En
behind.
este camino se han sumado
On
países de
this path,
todas las regiones y rincones
countries
del
from
mundo,
all
a
regions
quienes
and
les
areas of the
expreso
world
mi más
have
profundo
joined
agradecimiento,
their forces, and I'm most
dado
grateful to
que
them.
han sobrepuesto el bienestar de su
Given
población por encima de
that
cualquier otro fundamento.
They have
Mi
put above
profundo
all the well-being
agradecimiento
of
para
others, so I'm
Argentina,
most grateful to
Bangladesh,
Argentina, Bangladesh,
Barbados,
Barbados,
Bélgica, Belice,
Belgium,
Bután,
Belize,
Brasil,
Bhutan, Brazil,
Chile,
Chile,
Ecuador,
Ecuador,
Egipto, Honduras,
Egypt, Honduras,
Indonesia, Líbano,
Indonesia,
Luxemburgo,
the
Malasia,
Lebanon,
Maldivas,
the
México,
Maldives,
Mongolia,
Mexico,
Mozambique,
Mongolia,
Noruega,
Mozambique,
Omán,
Norway,
Países
Oman,
Bajos,
the
Pakistán,
Netherlands,
Palau,
Pakistan,
Panamá,
Palau,
Perú,
Panama, Peru,
Portugal,
Portugal,
República Dominicana,
the Dominican
San Vicente y
Republic,
las Granadinas,
St. Vincent and
Sudáfrica,
Grenadines,
Sri
South
Lanka,
Africa, Sri
Sudán,
Lanka,
Timor
Sudan,
del Este,
Timor
Uruguay
Leste,
y Zimbabue.
Uruguay, and Zimbabwe.
Aquellos jefes de Estado y
Those
jefes
heads
de
of
gobierno
state and
que
heads
aún
of
no se han
government
sumado a este
who
esfuerzo,
haven't yet
los
joined this
invito a no dejar pasar la
initiative, I
oportunidad
invite you
y
to
ser
not miss
parte
this
de un
opportunity
hecho
and to be
histórico
part
para la humanidad.
of a historic
Les
event
garantizo que
for
nada
humanity,
será más reconfortante y
because nothing
gratificante
will
que,
be more
dentro de unos años,
pleasing than
cuando
in some
historiadores
years
analicen
when
este momento
historians look
crucial,
at this crucial moment,
vean que
that you
todos
will
nuestros
see
países
that
fueron
all of our
parte de
countries
los
were
actores
part
internacionales
of the
que dieron un
international
paso adelante
stakeholders
y
who
tomaron
took
una
a
decisión
step
visionaria
forward
y
and
más
took a
importante aún,
visionary decision
profundamente humana.
for
Como gobernantes
great
debemos respaldar este
humanity.
llamado
So we
solidario,
must support this
declarando
call of
nuestro
solidarity
apoyo al
by
reservorio,
joining
en
the
inglés
support
llamado
to this, to
COVID-19
the
Technology
COVID-19
Access Pool,
Technology
CAP,
Access Pool,
de conocimientos de propiedad intelectual y datos.
which will look at
Debemos
knowledge
alentar a
and
nuestras
intellectual
empresas
property.
públicas y privadas,
We must call
así
on our
como a nuestras instituciones de
public and
investigación,
private companies
para
as
que
well as our
contribuyan de
research
manera
institutes so that
voluntaria
they can
a la
contribute
plataforma de
in a
intercambio.
voluntary way to the exchange
Se nos han
platform.
sumado igualmente actores
We have also
del ámbito
seen actors
internacional
from the
que han dedicado
international
su labor a la
area
búsqueda del
who have
bienestar de las
been dedicating their
poblaciones que
work
más
to
sufren.
find
Su vocación de
solutions to the
servicio y
well-being of the
proactividad
populations that
merecen
suffer the
también
most. So
mi
their
reconocimiento.
activity also
Igualmente al sector
deserves
privado,
my recognition.
se nos ha acercado
This
con el
private
afán de
sector
conocer la
has come
propuesta
to us
e
to
identificar cómo
understand the
pueden ser
proposal and
parte
to
de ella.
identify how they can
Celebro
be
este
part of
paso al
it.
frente
So
de quienes
I
han entendido
celebrate
que solo en
this step,
alianza desde lo
because
público y lo
those who have
privado
understood that only
podremos construir
through a
un futuro mejor.
public-private partnership can
Un
we
futuro
build a
donde
better
todos
future.
los brillantes
future where
avances científicos de
All of
nuestras
the brilliant
sociedades
scientific
sean
advances of
pilares
our
en la
societies will be
construcción
pillars
de
in
un
the building
horizonte que
of a
dignifique cada vida,
horizon
un
which
futuro
will
donde
give
nuestras
dignity to
capacidades
each
sean
life,
potenciadas
and
para
a
seguir
future where our
cimentando
capacity
el
will be
camino
made
de del desarrollo sostenible.
stronger so that we can work towards
Para citar un
sustainable
ejemplo de
development.
buenas prácticas en Costa
To
Rica,
give an
el
example of
sector
good
privado
practices in
también ha
Costa Rica,
ofrecido
the private
su
sector has
contribución.
also offered its
El compromiso de
contribution,
la industria
the
es necesario
commitment
para
of
hacer eco
industry,
a este llamado
which is
solidario.
necessary to answer
Boston
this call
Scientific,
of solidarity.
en
Boston
conjunto con la
Scientific,
Universidad de
with
Minnesota,
the
bajo el concepto de
University of Minnesota,
solidaridad y
under the concept
responsabilidad
of
social
solidarity
corporativa,
and
le ha
social
brindado la
responsibility,
preaprobación al gobierno utilizar de forma
has
abierta
given
el diseño
pre-approval
del
for the open
ventilador
use of the
Covent
design of the
con
Covent
el fin de que este dispositivo
ventilator,
médico
so that
pueda
this
ser
medical
fabricado de
device
manera
can
local
be
a través de las
manufactured on
compañías
a
que así lo deseen.
local level by companies
La
that wish to do so.
solidaridad dentro
Solidarity
y entre los países y el sector
within
privado
and between
es
countries
esencial si
and the
queremos
private
superar
sector
estos
is
tiempos
essential if we
difíciles.
want to overcome
Necesitamos
these
liberar
difficult
todo el
times.
poder de la
We need
ciencia
to
para
free up
ofrecer
all of the power of
innovaciones
science
que
so that we
sean
can
escalables,
carry out innovation which
utilizables y que
is
beneficien a
scalable and
todos
can be
en todas
used and
partes al mismo
assist
tiempo.
all
Solo
in
por
all
medio de la
parts of the world.
aceleración de la
It's only through
investigación
the
y del
acceleration of
desarrollo
research
de
and
tecnologías
development
sanitarias
of
contra el COVID-19
technologies
es que
against
podremos salir adelante.
COVID-19 that we will be
Sin
able to
embargo, ningún
succeed.
Estado podrá haber superado la
Nevertheless,
pandemia
no
hasta
country
que
will
todos la
be able
hayamos
to
superado,
overcome the
por lo que
pandemic
estos
until we
desarrollos
have
deben
all
ser
overcome it.
asequibles para
So the
todos.
developments must
Por eso
be
invito a las
affordable
industrias y
for all.
sectores
That's why
académicos,
I call on
así como he
industries
invitado a
and
la industria y
academic
academia
sectors,
costarricense a que
just as
registre y
in Costa Rica,
comparta
that
su
they register
conocimiento,
and share
propiedad
their
intelectual
knowledge
y
and their
datos de
intellectual property
tecnologías
and
sanitarias existentes y
data
nuevas
and
para
healthcare
combatir COVID-19
technologies
por el bien de
so that
toda
we
la
can
humanidad.
overcome
La Universidad de
COVID-19
Costa
for all
Rica
of
ha
humanity.
desarrollado y
The
pone a
University of
disposición
Costa
de la
Rica has
humanidad
developed and
un
makes available
protocolo
to
para la
humanity
manufactura a partir del
protocol for
plasma
the
de pacientes
manufacture from
convalecientes de
convalescing
preparaciones
patients'
inyectables
plasma,
de
injectable
inmunoglobulinas
materials
humanas
of human
hiperinmunes contra el
hemoglobins, which are
SARS-CoV-2 para el
hyperimmune
tratamiento de
to
pacientes en
SARS-CoV-2
estado severo
for the
y
treatment of
crítico de la infección.
severely ill patients.
También estas dos iniciativas relacionadas
These two
con
initiatives,
el diseño y
which are related to
validación
the
de
design
hisopos para las
and
pruebas
validation
diagnósticas del
of the
COVID-19
diagnostic
y el
tests for
desarrollo de los prototipos de
COVID-19,
respiradores para
such as the
posteriormente
development
trasladar
of
el
ventilators so that
conocimiento del
the
sector
knowledge
industrial.
can then be
El
transferred.
Instituto Tecnológico de Costa Rica
The
se
Technological
hace
Institute
presente
of
en
Costa
este
Rica
repositorio y nos ha
is
autorizado para
in
que
this
Costa Rica
repository and has
ponga a
allowed us so
disposición
that Costa
internacional
Rica can make
tres
internationally
diferentes
available
iniciativas que se
3
trabajan
different
para combatir
initiatives
el
which are being worked
COVID-19.
on to fight
El
against
desarrollo de
COVID-19.
mascarillas
The
tipo
development of
N95,
N95
el diseño de
face masks,
cobertores para
the
camillas
design
de ambulancias para la
of
Cruz
covers
Roja,
for
el
stretchers for
ventilador
the
mecánico
Red
de
Cross
accionamiento
ambulances
neumático.
and a
Por su parte, el Centro
mechanical
Nacional de
ventilator
Innovaciones Biotecnológicas,
and the
CENEBIOT,
Center
pone a
for
disposición de este repositorio
Biotechnological
un proyecto que
Development
consiste en
has put forward
optimizar
a project which
protocolos escalables de
optimizes
detección de
scalable
virus
protocols for the
SARS-CoV-2
detection of
que
the virus
prescinden del uso de
SARS-CoV-2,
kits comerciales
which come from
y
the use of
minimiza
commercial
la
kits
dependencia
and
de sistemas
minimize the
robóticos.
dependence.
El objetivo es crear
The aim
alternativas
is
en
to
caso de
create
escasez de kits
alternatives if there
y
is a
facilitar
scarcity
su
of kits
implementación
and to
en
facilitate
regiones
their
con acceso
application
limitado
in
a
regions
sistemas
with
robóticos.
limited access
La
to
propuesta está
robotic
inspirada
systems.
en casos de
This
éxito
is
obtenidos
inspired
en
from
Uruguay,
success stories
España
that we've
y
seen
por
in
el
Uruguay,
consorcio
Spain,
COVID,
and
pero se
the
adaptó a la
COVID
realidad
consortium.
regional y los
But it
resultados
adapts to
se
the
pueden
regional
compartir
reality and the
libremente.
results can be shared freely.
Nuestra sociedad civil, siempre
Our
activa y
civil
pujante,
society
es fundamental en el proceso,
is
defendiendo la
essential in the
iniciativa
process
y abogando para que
by
más y más actores
advocating
se
to
integren
ensure
de
that
manera
more and more
solidaria.
actors
Por ejemplo,
join in
su
a
papel será
way of
importante
solidarity.
para
For
convencer
example,
a
it's
los titulares
important
de los derechos de que se
the
necesitan
rights
ser
holders
socios
be
en esta
convinced
iniciativa.
that they need to be partners
El
in our
conocimiento
initiative.
compartido, la propiedad
Shared
intelectual
knowledge,
y los datos
intellectual
abiertos
property, and
cristalizarán
open data
nuestros
will
esfuerzos
make
colectivos
real our collective efforts
para avanzar en el
in order to
descubrimiento
advance
científico,
in
el
scientific
desarrollo
discovery,
tecnológico y el amplio
technological
intercambio
development,
de los beneficios del
and
avance
the change
científico
of the
y
benefits
sus
of scientific
aplicaciones
process,
basadas
progress
en
and its
el
use
desarrollo de la salud.
based on the
Esta
development of health.
iniciativa establece un modelo
This
viable
initiative
para
sets up a
promover el
viable
acceso
model to
basado
promote
en la
access
equidad,
based on
la
equity,
ciencia sólida,
solid
la
science,
colaboración abierta y
open
la
collaboration,
solidaridad global.
and global
La solidaridad
solidarity.
global acelerará la
Global
ciencia
solidarity
y
will
ampliará el
speed up
acceso a los
science
bienes
and
públicos
will
globales
open
para que sean
access to
juntos y así
public goods
podamos vencer el virus.
so that we can overcome the
Cada
virus.
compromiso, cada paso al
Each
frente
commitment,
cuenta.
each step
Nuestros
forward
pueblos nos
counts.
observan
Our
y
peoples are
esperan
watching
liderazgos
us
capaces de
and are
trabajar
looking for
colectivamente
leadership
por
which is
soluciones
capable of
verdaderas,
working
por
collectively to
acciones
find real
conjuntas
solutions, for
que nos
joint
permitan sin
actions
egoísmos
which will help us
reconstruir un
without
mundo
any
donde la salud pública
selfishness, work
universalmente
towards a world
resguardada
where public
sea un bien.
healthcare is
Confío plenamente en el
universal and
potencial humano,
safeguarded.
su capacidad de
I continue
innovación
to believe
y en su
in the
comprensión de que
potential
cada
of
vida es una
humanity
historia,
and our way
son
to be
afectos, son
able to
ilusiones,
bring
y
about
que vale el
change. Every
esfuerzo
day
de
is a
trabajar
story, and it's
sin
worth
descanso, de
working
manera
tirelessly
colaborativa, sin
in a
egoísmos,
collaborative way,
en
without any
multilateralismo,
egoism,
sector público, privado,
between the
academias,
public
empresas,
and private
sociedad
sectors, with
civil, para que pronto
academia and civil
ninguna
society,
vida se
so that
apague
soon
a
no
causa
life
de esta
will
pandemia.
be lost
De corazón,
because of
a
this
todos los
pandemic.
participantes de este foro, de este lanzamiento
A
y
full
de esta
heart
iniciativa,
to all those
muchas
here
gracias,
at this forum
porque lo que
and to all
queremos es
participating in
apoyar
this
a todas las
initiative.
personas
Thank you
de
very
todo el
much.
planeta
We
que
want to
hoy
support
lo necesitan.
everyone
Muchísimas
throughout the
gracias.
planet who needs this. Thank you.
Thanks for that. I'm going to now give the floor over to the Honourable Mia Motley, the Prime Minister for Barbados. Prime Minister Motley, I hope you're there and can hear us, and you have the microphone.
¿Tienen la lista?
Thank you very much. Can you hear me?
We can hear you loud and clear. Yes, go ahead.
Thank you very much. Today I join in solidarity with President of Costa Rica, my friend Carlos Alvarado Quesada, and my brother Dr. Tedros Adhanom Ghebreyesus, the Director General of the WHO, and indeed my colleague heads of government, to add Barbados' strong support for this launch of this important platform. I also want at this stage to commend and to thank the Deputy Secretary General of the United Nations, my sister Amina Mohammed, for her strong support at the outset of the launch of this platform. Like few other threats in our history, this pandemic shows up our common humanity in the most unequivocal of ways. Through our interconnectedness and our interdependence, the virus has reached all corners of our globe in a matter of months. It is almost like a horror story. Each of us has a story of human and economic loss, and what we write on history's page as our success story is yet to be determined. My friends, I tell you that it is our common humanity that brought us to this point, and it will only be through our common humanity that we will emerge from it. And let us pause for a minute and think why. The reality is that democracy and multilateralism promised for both the countries and the world respectively that there would be a framework of fairness, transparency, and accountability for those who choose to agree to the compact that led to the democracy or led to the multilateralism. Regrettably, the last few months have brought us closest to the wild, wild west of fictitious fame. We have, in the small island developing states, stories enough to tell about lack of access to basic medical equipment, medical supplies, and we fear that when the therapeutics and the vaccines come, unless we assert the right of the multilateral institutions of our world to create that corridor of fairness, to reinforce the transparency and accountability that we need, then we are not going to fulfill the promise of the United Nations and the corresponding institutions that came out of the 1945 Pact that allowed the world to have a new order. Access to new data and health products, therefore, to treat and prevent COVID-19 patients must not create winners and losers. And small states, who are often the casualties of market conditions, cannot be dispensable in the wake of this disease. I pause again to indicate that the consortium, the professional consortium being established by the Global Fund in order to procure many of the in vitro diagnostics, cannot simply use a proxy of maternal mortality to be able to determine who should benefit. Because if they do, 13 countries in this part of the world, 10 from within the Caribbean, will be at a serious disadvantage. And we cannot command the types of orders because of our lack of size in order to be able to guarantee access. Barbados therefore calls on all stakeholders to make the tools of this recovery that the WHO and others are working on a global public good. I heard Dr. Tedros just now outline very clearly what we needed to hear as small island developing states. We therefore also encourage all flexibilities in the licensing of these products to quickly scale up global production. And we ask for full cooperation with the UN's Technology Access Partnership so that the global community could exit this crisis together on fair and equitable terms. For this is the promise of the multilateral institutions upon their formation to the people of the world, and it is the promise of democracies at the time of the settlement of independence to our people. Surely, we all know that our markets will recover, and undoubtedly, market competition will return. But for now, it is time to heal. And as we heal, it is time to reflect on the values and principles that led to the modern settlement of the global community in which we function, and to recognize that the challenges that are literally undermining that settlement must be fought on head on, and that the only way we can fight it head on is by those of us who constitute the majority, even if not the power of the few who are at the top, to come together and to assert that transparency, fairness, market access, and accountability must matter and must be attained for the people of the world. I thank you and I wish you all the very best in your deliberations.
Prime Minister Motley, many thanks indeed for that statement of support for this initiative. Fairness and equitable access is clearly the key buzzwords as we continue through this discussion. I'm going to move now to speak to Axel Jacobsen, who is the State Secretary in the Foreign Affairs Ministry in Norway. Mr. Jacobsen, I believe you are on the line, and if you are, then make sure you're unmuted and please go ahead with your statement.
Thank you, Hannah. Can you hear me?
We can hear you loud and clear, yes. The wonders of technology. Go ahead, sir.
Thank you. President Alvarado, Director General Dr. Tedros, colleagues, I'm honored on behalf of my country, Norway, to co-sponsor the Solidarity Call to Action, to establish a platform for open, collaborative sharing of knowledge, data, and intellectual property on existing and new health tools to combat COVID-19. As I speak, the official counts have passed 360,000 deaths globally from COVID-19, and the true figure is likely to be substantially higher. The pandemic represents a tragedy for its victims and their families, and economic hardships for hundreds of millions around the globe. If there's one thing this pandemic has reminded us, it is that challenges that are global can only be faced efficiently if we act together in a coordinated and global manner. It has also reminded us how vulnerable we are when we are confronted with a new virus without efficient tools to fight it. It is now of paramount importance that the world's best researchers and developers join forces in an unprecedented manner to provide us with these tools. Again, global challenges needs global solutions. I'm convinced that the only way to succeed is to collaborate and share knowledge and technologies to have the necessary tools as soon as possible. Once we have effective medicines and vaccines, they should be distributed in a fair and equitable way, according to public health criteria. This is the only way to curb the acute pandemic in the most efficient manner. The World Health Organization plays a vital role in facilitating the necessary sharing of knowledge. Rest assured that Norway stands firmly behind you in these efforts. Thank you again, President Alvarado, for raising this issue and for bringing us together today. Thank you very much.
Axel Jakobsen, thank you very much indeed. We are now going to move on and speak to Her Excellency Ambassador Monique Van Dahlen from the Netherlands. The ambassador is the representative of the Netherlands to the United Nations in Geneva. I believe you are on the line. I think I saw you earlier. So Ambassador, you have the floor.
Yes, okay. Thank you very much, Mr. President, Madam Prime Minister, Director General. The Netherlands supports the need for international cooperation and solidarity in combating COVID-19. The sharing of knowledge, intellectual property and data can play an important role in the development of vaccines or treatments that are affordable and accessible to all people in the world. This is especially true for knowledge that is created with public funding. The sharing must, in order to be effective, have a voluntary basis. We acknowledge that we need industry as a valuable partner. Their capacity to innovate, their expertise in development, production and distribution of vaccines and treatments, and their willingness to take risks must be valued alongside international cooperation, public investments, and the sharing of knowledge. The main goal that we all want to achieve is a vaccine or treatment that is affordable and accessible to us all. In an innovation model based on the pooling of knowledge is, next to possible alternative models, a valuable instrument to pursue this aim. We thank Costa Rica and the WHO for their leadership and look forward to continuing to work together in fighting this public health crisis. Thank you very much.
Thank you very much, Ambassador. We now move to Her Excellency Ambassador Maria Ferrani, who is the permanent representative of Brazil to the United Nations in Geneva. Ambassador Ferrani, if you can hear me clearly, then please do unmute yourself and you have the floor.
Okay. Director General, President Carlos Alvarado of Costa Rica, Excellencies, colleagues, ladies and gentlemen. I'm not sure you listen to me. Are you listening to me? Yes? Okay, so I'll start again. You have to listen again. Director General, President Carlos Alvarado of Costa Rica, Excellencies, colleagues, ladies and gentlemen. Brazil is honored to support this solidarity call to action and to participate in this launch event. We thank President Alvarado for his pioneering proposal and relentless work to bring all relevant partners together at this point. Access to quality, safe, efficient, and affordable health technology remains a top priority for Brazil, all the more so in the context of this pandemic. Access to affordable medicines is key to build and strengthen sustainable and resilient health systems, to achieve universal health coverage, and to respond to health emergencies. In the case of COVID-19, universal and equitable access to life-saving technologies is the only way to ensure that everyone, everywhere, will be safe and able to return to normalcy. Brazil is gratified to see that the global strategy and plan of action on public health, innovation, and intellectual property is one of the references for the call to action. Together with many partners, Brazil has led efforts to have this global strategy fully implemented to the benefit of all. We are confident that the call to action will be a major achievement in the public health worldwide, helping us all to rise up to the challenge posed by COVID-19. Thank you very much.
Ambassador, thank you very much indeed. We now take you over to Portugal. Dr. Rui Ivo is the president of the National Medicines Authority in Portugal and joins us live as well. Dr. Ivo, you have the floor.
Hello, you can hear me?
We can hear you very clearly, yes. Go ahead, please, sir.
Thank you very much. President Carlos Alvarado of Costa Rica, Excellency, Director General of WHO, Dr. Tedros Ghebreyesus, distinguished participants from other states and institutions, representatives from academia, international partners, industry, civil society. It is with great pleasure that I send you warm greetings from Portugal and add our voice to the call to action proposed by Costa Rica and supported by the World Health Organization. A call that aims at ensuring equitable access to health technologies through sharing of knowledge and data indispensable to the diagnosis, prevention, treatment, and response to the pandemic outbreak of COVID-19. This initiative calls for a global priority in equitable access to health products and refers as to the importance of ensuring the principles of sustainability, availability, and accessibility of safe, effective, and quality health products, which more than ever are fundamental to tackling the current pandemic. It also stresses the need to guarantee the production, supply chain, and equitable distribution of essential health products to our fellow citizens. Finally, considering the potentially devastating economic and social repercussions for health, particularly for developing countries, this section also calls for effective international cooperation in order to strengthen our health systems for this and future pandemics. Knowing that we all share these values, Portugal joins this call to action and its commitment to the collective success in combating COVID-19. Thank you very much for your attention.
Dr. Ivo, thank you very much. We do now have a representative from South Africa. Now we have the Health Minister, the Honourable Minister, Dr. Zwelini Mkhize, who is on the line for us. Dr. Mkhize, please, your supporting statement for this initiative.
Very much. Excellencies, from South Africa, on behalf of President Ramaphosa, I take this opportunity to congratulate the Director General of the World Health Organization, Dr. Tedros, and the President of the Republic of Costa Rica, His Excellency, Mr. Carlos Alvaro Quesada, for launching this important initiative. We also appreciate the cross-regional efforts to realize equitable global access to COVID-19 health technologies as a critical response measure, as now more than ever, the world needs this solidarity and cooperation to pool knowledge, intellectual property, and data for existing and new diagnostics, therapeutics, vaccines, and for the detection, prevention, and treatment of COVID-19. The solidarity call to action calls on key stakeholders and the global community to commit to undertaking actions which are urgently needed to advance the sharing of knowledge, intellectual property, and data that will benefit all humanity. It is also an important complement to the ACT Accelerator, which was launched a few weeks ago, which aims at making diagnostics, therapeutics, and vaccines for COVID-19 accessible on the basis of need worldwide. We'd also like to emphasize the importance of governments and international partners uniting around a global guarantee that ensures that when a safe and effective vaccine is developed, it is produced rapidly, at scale, and made available to all the people in all countries free of charge. We therefore call upon member states and the international community to support the solidarity call to action to promote health and to ensure the achievement of universal health coverage globally. Thank you very much.
Honourable Minister, many thanks indeed. As those who have been watching so far with this launch, the launch of this initiative, you will have noticed, and we've just had a series of supporting statements, and now we're going to move on to the next part, which is the moderated discussion. So we have a whole array of panellists who are going to be joining us. They're experts, they're industry experts, civil society representatives, members from academia as well. So first of all, I would like to welcome to the discussion Professor Mariano Mazzucato, who is a professor in economics of innovation and public value at the University College London. Professor, I believe you're on the line, and I'm just hoping that your video is on and your audio as well. And my first question to you really is, we're talking about a pool of technology. Why do we need this patent pool right now in the middle of this pandemic? Why is it necessary? There we go. Good. It said that the host wouldn't unmute me. Well, it's absolutely necessary because there's no other choice. I mean,
really from the policy perspective, because this is in fact a policy proposal, we need to frame it as actively shaping and creating this market in the way that needs to be governed to satisfy the mission, which is a vaccine that is globally accessible for free around the world. And that really means making sure that we govern the process from the intellectual property, which of course this common pool is focusing on, the pricing, the manufacturing capability, the international collaboration and solidarity instead of competition between countries. But to do that, it really means also thinking through what does it mean when countries globally have been putting in billions really into the health innovation market. And then unfortunately, unlike the military, when they spend money on areas that they need, they then govern the process to make sure they win the war. Even though I don't like the war narrative, it does actually mean governing this process in such a way that the pricing, the IPR, the licensing, is done in such a way to really foster what the 21st century is about, which is collective intelligence.
Okay, Mariana, that's really interesting. I want to bring in a fellow economist now. Professor Joseph Stiglitz is a professor at Columbia University. Professor, I'm wondering whether you agree with that, whether you think this type of technology access pool is necessary for the distribution of health technologies whenever we come up with them.
Absolutely. Intellectual property is a social construction that is designed to promote innovation. But in this particular case, the government is taking the key role in financing the research and having those ideas. The most important input into any research is other ideas. And that's why this pool of ideas is absolutely essential if there's going to be the fastest innovation possible. And speed is extraordinarily important in dealing with this pandemic. The longer it lasts, the more people die, but the worse the devastation for the economy. So it's actually important in this case, especially, that there be this kind of patent pool, that this knowledge be used quickly for the benefit of everybody in our global community.
I'm going to try and connect now with Dr. Jacques Dubochet. I'm hoping that he's on the line as well. Dr. Jacques Dubochet is a Swiss scientist. He's also a Nobel laureate. Sir, I can see you. Wonderful. I know that you've advocated for open science. I'm wondering if you can just explain to all of us what exactly you mean by that and the role that you think that science should play going forward with this initiative.
Oui, vous voyez, le COVID-19 est un intéressant exemple d'un mal commun. Il est méchant avec nous tous, et tant qu'il existera quelque part dans le monde un malade, ce malade est à nous tous. Et l'épidémie peut revenir, elle est avec nous tant qu'il y a des malades. C'est un mal commun. Mais à tout mal commun, on peut faire correspondre un bien commun. Et ce bien commun, c'est cette connaissance que tout le monde est en train d'acquérir et qui, peut-être un jour, bientôt, va nous aider à soigner, à guérir un bien commun. Faisons ce bien commun. Et c'est justement l'idée de cette initiative de la porter et que tout le monde travaille à cela. Mais il y a plus, parce que c'est un exercice formidable, un exercice visible. On en a besoin. Et il nous prépare un autre mal commun que nous avons besoin de traiter comme bien commun. C'est bien, c'est le problème du climat et le problème de la vie qui se dégrade dans l'ensemble de notre planète. Le virus, nous en sortirons et nous sommes au travail maintenant. Bravo, grâce à cette initiative. La planète, c'est la suivante. Et ce n'est pas la plus petite. Bonne chance à nous tous.
Boa sorte a todos nós.
Dr. Dubochet, many thanks. We are going to move on now and hopefully speak to Philippe Duneton, who is the ad interim executive director at UNITAID. Mr. Duneton, if you can hear me, I hope you can. Unitaid is a huge WHO partner and very much involved in this particular initiative. Can you just describe for those watching in the media, the public as well, what exactly Unitaid's role will be with rolling out this type of pool?
Hello, good afternoon and good morning for everybody. I hope you can hear me. So it's quite important as an initiative in call for action. Unitaid is fully involved in the development of therapeutic and diagnostic under the ACT call for action, and we are working closely with partners, but also with WHO, of course. And finding the right medicines, the right diagnostic and the right vaccine is not sufficient. As it was said, it's quite important to make sure that it can be affordable everywhere at a low price. As Unitaid, we have a lot of experience in making the connection between the innovation and, of course, the scale-up. And we have created 10 years ago now the medicine patent pool that is coping with of course, the industry to make affordable medicine for HIV and, of course, hepatitis C. It is a great success because now, as I speak, we have a million of people who can benefit from the latest innovation to fight HIV. And I think that this initiative today is very important also to make sure that we will have equitable access for the new vaccine, for the treatment that we need to fight COVID-19.
Thank you. Let's bring in Greg Alton. Greg is a former Chief Patents Officer for Gilead. Greg, if you can hear me, and I hope you can, we're obviously talking about patents now and intellectual property. I'm wondering, and I'm sure many other people watching this will be wondering as well, with all good intentions aside, what will it take to get companies on board to share their intellectual property and their knowledge?
Great. I think I'm on mute. Is that?
Yes, you are. Yeah.
Okay, great. So first, let me just hold on. I got something weird on my screen here. Let me just start with, I think that, and Dr. Tedros said this initially, I'm a big supporter of intellectual property and the role that the industry's played in bringing medicine forward. However, with some things, I think that, the reason I'm very supportive of this call to action. First of all, in terms of fair and equitable access, I do think it would be fantastic to see the industry come forward and commit to working with the medicines patent pool or other mechanisms to make the intellectual property that comes out of the products that we develop, whether they're vaccines, therapeutics, or diagnostics, to be produced by generic manufacturers and then made available in fair and equitable terms globally. I do think to make this happen, we have to expect and respect that different companies will have different concerns that they'll have to be addressed around whether, if this is truly voluntary, geographies, around different tierings of geographies, understanding that the poorest countries of the world, what's fair and equitable for them will differ from middle income countries, that will differ from wealthy countries. That's the way the industry is going to look at this. I think they're going to look at protection around their commercial interests, their indications, their uses. But I do think this can be done. We've seen this done we did in HIV, we've done this in hepatitis. I do think it's a good model, and I think I would love to see the industry come forward today while these products are being developed and make a commitment to make these products available for generic production, for local production, and get to what those terms are that will be acceptable. And it's going to vary from country to country. The other thing I just want to touch on why I'm very excited about this call to action is we don't have these products yet. We do not have the therapeutics. We do not have the vaccines. We do not have the diagnostics we need. I do also believe that the component of pooling knowledge, pooling data, creating a forum where this data can be shared to create those new breakthrough products is more important today, given this epidemic, than we've ever seen before. The human and economic costs. We cannot wait for the typical development timeline of a vaccine or a therapeutic. And I think this is an opportunity to see if this pooling of knowledge, sharing of information, sharing of intellectual property, of breaking down these barriers can expedite that development. and allow these breakthroughs to come through. And if this works in COVID-19 or in this particular epidemic, maybe then this model could be used for some of the neglected diseases around the world that the current IP and industry model doesn't work well for.
Greg, thank you. I wonder if I can just bring back Professor Joseph Stiglitz to comment on that, really. I'm wondering whether, Professor, you think that we can perhaps use this concept of a patent pool as an opportunity to prepare for future crises as well?
Oh, very much so. And what I wanted to emphasize are a couple points. One, the production of knowledge, as I said before, the most important ingredient is other knowledge. And when speed is important, as it is in this pandemic, you want that knowledge to be shared very quickly. What's interesting is that talking to my friends who are in the research community, that is happening at the individual level. But the question is, will the corporate level, will the institutional level buy into this? And what I find so exciting is the commitments being made all over the world in support of this. There's a second aspect that I want to highlight, which is we're going to need billions of doses of whatever medicines are going to be produced. That means it's really important to scale up at a low price. And the point, as long as this disease is going on in any part of the world, we're all going to be vulnerable. So it's really important in the interest of all of us that the prices be low. And that's not going to be achieved through monopoly pricing of the drug companies. It's only going to be true if we make sure that there's access to generics, to local producers, the widest dispersion of production. Now, there has to be return to those who are making their research, although much of the money is coming from the government. We should be clear about that. It's been de-risked. But we can do that through royalties, through charging for appropriate prices. That can be done within the patent pool. But what is really important here is the prioritization of speed and price accessibility. And that's really the idea behind this initiative, which I really commend you for.
And Mariana Mazzucato, I believe you want to come in on this.
Yes, I mean, I really think this is going to be the moment to make sure that we walk the talk of what kind of public-private collaborations should be in a space like this. And I don't think hepatitis C is a good example, with all due respect, Mr. Alton. This is actually the area where so many have written about, an area which received billions from, for example, the National Institutes of Health, 10 years of research, and then ultimately was marketed for $84,000 for a 12-week course, one pill a day. Now, that whole issue of how can we actually produce, again, as I was saying before, along the whole value chain, so governing the patent system, as we're talking about today, but also the pricing system that really reflects that collective effort that we're making in so many different parts of the health industry. This is a problem that goes beyond vaccines. Why this initiative is so important is we cannot risk getting it wrong. We have to today use this almost as a sandbox that hopefully will also create lessons for other parts of the sector. And in terms of what Joseph Stiglitz was saying, of course patents are important. They have simply been massively abused. They are too upstream. We today are patenting the tools for research. They're way too strong, hard to license. They're too wide. They're used for strategic reasons. So again, using this moment to also think much more broadly, how can we make patents do what they were meant to do in the beginning instead of really just fueling a lot of rents and monopoly power?
Mariana, thank you. Charles Gore is the Executive Director of the Medicines Patent Pool, which Dr. Tedros mentioned at the beginning of this launch. And Charles Gore, if you can hear me clearly, based on your experience at MPP, when you have a patent pool already, can this scale and level of cooperation work? Does it work in practice?
Thank you very much indeed, Hannah. And just before I answer your question, I'd like to thank WHO and the Director General, Costa Rica, and President Alvarado for inviting us to be part of this initiative. Perhaps I should just talk a little bit about our history to answer your question. So we were set up by Unitaid in 2010 as a public health organization. to do voluntary licensing to enable access to HIV medicines, and also to facilitate the development of new treatments in the form of, for example, pediatric combinations, single pill combinations, but also to make sure that, first of all, access was as quick as possible and also as equitable as possible, as Dr. Tedros said, to make sure that no one was left behind. And the success of that model led to the global community asking us to expand our mandate, firstly to hepatitis C and TB, and then more recently to any patented medicine on the WHO essential medicines list. And the model involves, first of all, working with experts and the affected communities and civil society to identify the needs, then working with the pharmaceutical industry to actually get the licenses, which we can then sub-license to many generic manufacturers that allows both scale up to meet large demands, but also competition between the generic manufacturers to drive the price down. And then finally, with also governments and the affected communities to let them know what is available to make sure that they do access these affordable but high quality drugs as quickly as possible. And finally, to manage this whole process. I think you can see from the fact that, as Philip Dunton mentioned, we've had a huge impact. I'd just like to mention that our generic manufacturers have now delivered 12 billion doses in the last 10 years. And based on that, our board at the beginning of the COVID crisis decided that we should offer that expertise and experience to the global community if it would be useful, and consequently expanded our mandate to include anything that could be useful for COVID-19. And so we're now in this position of being very willing to offer that expertise and experience in the form of a pool to try and make sure that actually initiatives like this really deliver. So we hope that we will have an important role in the operationalization of this important initiative. And we would like to think that we will be able to have the kind of impact we've had in HIV in COVID-19 as well. Thank you.
Charles Gore, thank you very much. Interesting to see that, you know, what you were saying about how the open licensing model does work, has been working already. And we've been hearing from experts and from the field of academia. Let's bring in civil society now. I want to speak to Achal Prabhala, who is from the coordinator, rather, of Access CIBSA project in India. Achal, I hope you can hear me and I hope we can see you. Tell us then, what is the role of civil society in this pool initiative? Oh, I think you may have dropped off. Apologies. Okay, let's move on then. Joshua Setipa is from the UN Technology Bank. He is the managing director. I hope that Joshua, you're on the call then. I'm wondering how can we ensure then that medicines are, as and when they become available, that they are then available on an equitable basis across the world? Question there for Joshua Setipa of the UN Technology Bank. No, I think, okay, we will move on. Anna Marriott, I believe we do have Anna Marriott. Anna Marriott is the health policy manager for Oxfam. Anna, there's been quite a lot of talk already about HIV and AIDS and the response to the crisis then. I'm wondering how conditions today compare with conditions then, and whether we are better equipped today to deal with this pandemic. Oh, if you just need to unmute yourself, please. There we go. Oh, no, still can't hear you. No, still can't quite hear you. Let me just see if we can get you just to unmute your microphone. If not, then perhaps I can turn back to one of our esteemed economists who've been joining us already. Perhaps, Mariano, I know you're still on the call. I can see you nodding away there. If you wanted to unmute yourself. Your thoughts on what we've been hearing then about using previous models or pre-existing models in order to move further with a response to COVID-19. And again, if you could unmute yourself.
We can't. Okay, here we go. Yes.
Yes. Okay.
I think the reason the others are having a problem, on our screen, it says the host has muted us. So when we try to unmute, it doesn't work. So whoever the host is, if you can ask them to.
I will. I hold my hands up and say, I'm not the host.
Sure. So, this is a huge issue. Just one thing that I think is really important is that currently this is only voluntary. What I have been arguing actually for some time is that this could actually become more mandatory. The reason, just as an example, because this shouldn't be pie in the sky, the reason we had, at least in the US, one of the most innovative private R&D departments in AT&T, it later became Bell Labs, a very famous research and development department, was that there was conditions attached to the public subsidy that AT&T was getting to make sure that they actually reinvested their profits back into innovation and big innovation beyond telecoms. The history of conditionality, sector by sector, does exist. And this is strangely one where for some reason we haven't made conditions on the governance of areas like patents to be present when you have this very high amount of public investment that both Joseph Stiglitz and I have been talking about. Again, 40 billion a year just in the US, but actually if you look globally, there's trillions of pounds, euros, different currencies being put into health innovation, and making sure that that public investment is also conditional on a governance of the system to actually meet a public interest test. I think, this could actually become the moment to do that, because as long as it's just voluntary and, every country negotiates it depending on bilateral relationships, it doesn't get us what we're actually talking about here. COVID has woken us up that, global health only makes sense when it's global. We are all only as safe as our neighbor is in our city, in our nation, and then globally. Had this epidemic begun in Africa, where health systems are actually much weaker than in China, we would globally be worse off. So governing this system in such a way that has strong public interest metrics, I think, is the big innovation that we all need right now.
Yeah. Anna Marriott, we could see you before, we couldn't quite hear you, but I believe your sound has been restored for us. I was asking you about the comparisons we can make today between what happened with HIV and AIDS and the response, or the climate, the conditions that we're operating in today.
So I think many of those conditions of inequality in access are still very real today. The very big difference that we're facing now is that this is a global crisis where everybody on the planet needs access to these technologies. That we've heard about global public goods to realize those in practical terms, but this is only going to work if every government steps up to the table and makes those commitments. And we're very, very welcome at the governments that have taken leadership today, but we need all governments to come to the table along with pharmaceutical companies. And I will say that some of the reactions from some pharmaceutical players today about this initiative is disappointing. We really need them to properly engage with the details of this pool, step up to the table. But alongside that, I just want to reassert this point that we are seeing millions of taxpayers' money being invested in the research and development for the medical solutions for this. We do need to see those conditions attached that will force the pooling, force the sharing of these solutions to this pandemic. The scale of the crisis is too big, it's too vast to leave it to the voluntary and philanthropic efforts of pharmaceutical companies.
Thank you. Achal Pravala, we were hoping to speak to you earlier, and I believe you're back with us again now. I was asking you about civil society and the role that civil society can have, not just in this particular technology access pool, but also just in response to COVID-19 in general.
Yeah, well, look, civil society has a limited role to play here. Civil society can put pressure on national governments, and national governments, especially those governments which have the capacity to manufacture tests and treatments and vaccines, who also have the political will to do what they need to do with intellectual property monopolies, can make some efforts to do their bit to contain the pandemic. But the truth is that we need the COVID-19 technology pool to succeed because it's really the best shot that the world has. Most countries in the world don't have the capacity to be able to manufacture what they need, even without the presence of monopolies that will thwart their ability to do so. But in saying so, we need to have a couple of things in place. The first is participation. We need to have the participation of rich countries. And along with that participation, we need to have the leverage that rich countries have in terms of their investment and buying of medical technologies so that they can then contribute to the pool. But we also need to look at the scope of the pool. In the past, a lot of access licenses have been satisfied to stop at poor countries, at getting access to poor countries. I think what we need to look at here is getting access to poor people, wherever they live, whether they live in poor countries, whether they live in what are called middle-income countries, or indeed whether they live in rich countries. I think if we go by the access models of the past, they've failed, primarily because they have failed to reach the vast numbers of poor people in a highly unequal country, like Brazil, for instance, simply because it's classified as a middle-income country, and it's assumed, therefore, that they have better access to buying drugs on the market or vaccines on the market, where in fact they don't.
Achal Pravala, thank you. I'm hoping that we can now speak to the Managing Director of the UN Technology Bank, Joshua Setipa. Joshua, if you can hear me, I'm just going to crack on with my question and hope that it's all clear with the connection. I'm wondering then, how can we ensure that medicines, once they are available, vaccines, etc., are available on an equitable basis, across the world?
Well, thank you very much for this opportunity. We, as a technology bank, we are an implementing partner of the Health Technology Access Pool and are working very well with the WHO, with the UNDP, and also with UNTAD in launching the Technology Access Partnership, which seeks to address some of these challenges that we've had so well articulated today. One of the realities is that having the technology available is one step, but where the challenge remains is how do you then transfer or transform that technology into actual capacity to produce and be able to meet the demand that we see that countries are facing today. And what we are doing as a Technology Access Partnership is to create a platform that connects technology holders with technology seekers and provide also support to be able to transform that technology that is available into actual capacity to produce. We are also working with to ensure that there is also capacity that will not only allow countries to meet their current COVID-19 challenges, but also be able to be part of their post-recovery effort. And one of the key areas of support that we are providing to developing countries is to also serve as a repository for these technologies, for data and for knowledge, and also to provide legal and policy support, which we know is very important for technology-seeking entities, and also to facilitate these partnerships, which are very key. As we've heard from our colleagues from civil society, this is an effort that requires all stakeholders on board. Otherwise, then there will always be gaps, and we know where there are gaps, the poor countries or the least developed countries are the ones that fall behind. Thank you very much.
Joshua Setipa, thank you very much. We've had lots of questions coming in from members of the public who are watching this. And so I would like to just sort of throw some of those questions, or at least one of them, when I can find them on my screen, back to our panelists as well. So perhaps to Dr. Jacques Dubochet, one question that we've had in is, what learning can we draw from knowledge pooling during the AIDS pandemic? And of course, this is something that we've been talking about a lot, but what learning can we draw from knowledge pooling during the HIV/AIDS pandemic? That question let's go to Dr. Dubochet.
I'm not a specialist of that. There are people who are much better for that. But nevertheless, well, the COVID is, oh, sorry, activez le son.
No, okay? we can hear you clearly, sir, yeah.
Oh, yes. Well, that I was saying before that this COVID is an exercise for the planet or what so. But also in Stockholm, when I gave my speech for my Nobel Prize, I was asking that anything about medicine, about health, is a common good for all the world. We have the problem, the case of COVID, and the COVID will be an excellent exercise for considering anything about medicine, about health as a common good for humanity. Woo! Good work.
Thank you very much, Dr. Dubochet. Another question. Let me just bring up my screen so I can see clearly. Let's put this question then to Professor Stieglitz. What guarantee can you give, or can the panel give in general, that this initiative will benefit everyone on the planet? This is, of course, what we're talking about in general, is how to make sure that this is delivered and distributed on an equitable basis. But what guarantee can the panelists here give that this initiative will do just that?
Well, I think what we can say is that it's going to be more equal than it otherwise would be. I don't think we can ever, in our very unequal society, expect anything to be fully equal. But what we know is that if we leave it to the usual mechanisms of monopoly pharmaceutical companies driving up the prices, it will mean that those who are poor, whether they're in the rich countries, the middle income countries, or the whole of the poorer countries, they won't have access unless we have this kind of patent pool. So to me, it's an absolutely essential step in moving towards greater equality of access. And remember, unless many people have emphasized the fact, unless the whole world is protected, none of us are protected. So it really requires a global effort to make sure that everybody gets access to the vaccines, to the testing, to the retrovirals, to the therapeutic medicines.
Philippe Duneton from Unitaid, I hope you're still with us. I could see you on the screen there. But another question, this is coming from viewers who are watching this broadcast. Who owns the data and how will it be governed? I don't know if this is an appropriate question for you, but I'm wondering if you care to offer an answer to that. Philippe Duneton.
Sorry. No, I think it's we are focusing on the IP, and I think it's correct because it's a barrier. But to make sure that, in particular for certain type of product, you need to have also a way to transfer the know-how, transfer the quality insurance, and also to have mechanisms to make sure that you have the right price. So. Of course, that's the question, and we discussed with WHO, we discussed with the medicine patent pool, because we know very well how this will work. But we need to also build a system that can cope with that kind of other type of information that we need to increase the production. Just a point, because I think that we need to be clear. If we get a treatment and potentially a vaccine, one company itself may not be in situation to have the capacity to address the volume. So it's something that we need to work on with the pharmaceutical industry. It's not just an idea, it's a practical need that we need to cooperate and to find solutions. That's why this framework and this initiative is quite important. But we need also the support of industry to find a way to address that very specific question you have. IP is important, and we have, with the medicine patent pool, a mechanism that is up and running, but we need also to address other type of information to make sure that we can increase really the production capacity.
And Greg Alton, if you're still there on the line as well, which I believe, again, you are, another question that's come to us from people watching is that a patent pool sounds like the most viable way forward, but what are the enablers and barriers to implementing this? Greg, can you hear us okay?
Yeah, I just was trying to turn my mute off. So the mechanism is there already. So we've already, and Charles talked about this, we've already seen success with the patent pool for access to medicine for products that already have been developed in HIV, now in viral hepatitis, and it's expanding into other areas. And with this patent pool, it's done on an individual company level. A company would go to the medicines patent pool, negotiate the scope of the license, so the countries that would be covered, that would have access to the generic medicines that we produced. There'd be quality and other conditions put on it, but it actually has worked quite well. But now to comment on some other speakers that have talked before, the bigger challenge is countries that are not within the medicines patent pool or were not covered by the scope of the license, in the countries in between, and then the wealthy countries. And it's going to be middle-income countries. It's going to be poor people even in wealthy countries that aren't covered. And so I think what's missing is how we address those populations. And I think we need to have a really rational conversation about what the commitments at the country level is. Take a middle-income country to provide access to poor people, in a wealthy country to provide access to poor people, and what a reasonable, fair, equitable terms from the industry would be to address that. The mechanism exists right now. What does not exist today is the sharing, the pooling of knowledge.
Oh, Greg, we lost you just at the end then, but I think you've wrapped up. My thanks to all the participants. We've reached that part in this session, in this very exciting launch, that when we're going to hear from some heads of state who haven't unfortunately been able to join us live, but they have spent the time to send us more supporting statements and video messages as well. We know that this is a global effort, a global collective effort. And as we've been hearing from all the participants so far, global challenges need global solutions. And I'm so thrilled that we have a number of hugely supportive statements from Excellencies, heads of state from across the world. So we will begin with His Excellency Lenín Moreno, the President of Ecuador, and then, as I say, we will go through several others afterwards. If we have time at the end, I will try to get to some more questions from those of you who are sending them in. If not, we will, of course, make sure that WHO is collating them, and we'll get back to you as well, perhaps with some direct messages from the experts from across the board who've been involved in the discussion today. Please do all stay on the line, all those who have been involved so far in the discussion, and we'll go through some of these videos now from our distinguished presidents and the like from around the globe. So first of all, let's hear from the President of Ecuador. This is His Excellency Lenín Moreno.
Friends, I'm pleased to declare our support in the United Nations call to action, calling for solidarity in ensuring.
Estimado amigo y presidente de Costa Rica,
Dear friend and President of Costa Rica, Carlos Alvarado,
General de la Organización Mundial de la
Director
Salud,
General of the
Dr.
World
Tedros
Health
Adhanom.
Organization, Dr. Tedros Adhanom.
Todos somos testigos del enemigo común que tiene en este momento la humanidad.
Common enemy that faces humanity now.
Ningún país tiene la capacidad de luchar en forma aislada. Y creo que ya nos hemos dado cuenta de ello. Las crisis globales como la pandemia del COVID-19 exigen de poner completamente intereses particulares. Exigen que todos los miembros de la comunidad internacional actuemos de manera conjunta, de manera solidaria, unida, a través de foros multilaterales como precisamente este de la Organización Mundial de la Salud, bajo la premisa de que la salud constituye un bien público global. Coincidimos en que la lucha contra esta pandemia exige que no reinventemos nosotros mismos, reinventemos la forma en que debe operar la cooperación internacional, que renovemos los recursos de investigación para desarrollar soluciones científicas que garanticen la salud de toda la población sin exclusión alguna. Debemos actuar de manera urgente, conjunta, para contener y contrarrestar la COVID-19. Tenemos que derribar las barreras políticas y técnicas que impiden el acceso al conocimiento y tenemos que implementar sistemas accesibles, abiertos y transparentes de propiedad intelectual, porque es deber de los Estados garantizar un derecho humano esencial, que es la salud de la población. Al llamado que realiza la Organización Mundial de la Salud deberán sumarse múltiples actores,
many more
tales como
actors
los
will have to
organismos
join the
financieros
WHO, such as
internacionales,
financial
las organizaciones
actors on an
humanitarias,
international
los
level,
organismos no
humanitarian
gubernamentales
agencies,
también deben estar ahí,
non-governmental
las entidades
agencies,
filantrópicas deben estar ahí,
and
las empresas
philanthropic
farmacéuticas privadas
foundations will
y
have to
los
join us,
proveedores de
private
tecnologías de
pharmaceutical
información y
companies and
comunicación, todos deben estar ahí.
providers of
Hoy Ecuador
ICT as
hace un
well will have
llamado
to join
a la
us.
comunidad
Ecuador
internacional
today calls
para
on the
acelerar
international
la obtención
community
de
to
soluciones científicas,
accelerate
para que el desarrollo
the finding
tecnológico
of scientific
científico ayude
solutions so that
y el intercambio
scientific
sea
development
amplio
helps and that we
y los
have
beneficios de la
wide-ranging
prevención
exchange
y respuesta
and that the
al
work for
COVID-19
prevention and
estén en
response to
manos de
COVID-19
Los
is
gobiernos
in the
cumplen un
hands
papel
of all.
determinante al generar
Governments play
mecanismos que
a
permitan que toda
significant role
investigación
in setting
sea
up
disponible.
mechanisms that ensure that
accesible
all research
escala
is
global.
available and accessible
Ecuador
on a
considera
global
que la
level.
pandemia
Ecuador
es sin duda
considers that the
una dificultad,
pandemic
un gran
is
problema,
without doubt a
pero a la vez
difficulty
constituye una gran
and a
oportunidad
problem,
para
but it
renovar la
also
vigencia
presents a
del
major
sistema
opportunity
multilateral,
to
con respuestas
renew the
articuladas,
multilateral
con
system
respuestas
through
integrales,
linked
basadas en los
responses and
principios
integrated responses based
elementales para
on the
ello, de cooperación,
principles
de solidaridad,
of
de
cooperation,
equidad y con
solidarity
un
and
enfoque
equity,
de
and
responsabilidades
with a
compartidas, devolver
joint
a la
focus,
ciudadanía también la
we can
responsabilidad que le corresponde.
return
En este
also
marco, mi país
responsibility to
suscribe hoy
citizens.
la acertada
So my
propuesta,
country
llamando a la
signs up
acción,
today
una acción para
to this
acelerar los
call
esfuerzos
for
de
action to
desarrollo
accelerate
que se están
efforts
haciendo
for development
en
that are
encontrar el
being made
tratamiento
so
y la
that we can
vacuna
find treatment
contra el
and
COVID-19.
vaccine
Muchas
against
gracias.
COVID-19. Thank you very much.
My apologies, I muted myself. Totally my fault. Now, we had a taster just before hearing from President Moreno of another president. Apologies for that mix-up. But we will now, our thanks, of course, to the President of Ecuador, President Moreno. We will now hear from the President of Palau, Thomas Isang Remengesau.
Friends, I'm pleased to declare Palau's support in the United Nations call to action, calling for solidarity in ensuring equitable global access to the health technologies being developed for the detection, prevention, control, and treatment of COVID-19. The Republic of Palau has been fortunate to be one of the few countries in the world with no confirmed cases of the coronavirus. This accomplishment has only been possible through the drastic but necessary measure of closing our borders to international travelers. Although we have successfully prevented the virus from arriving so far, we, like the many other island states that have taken the same drastic step, cannot keep our borders closed forever. Island states may seem isolated from the rest of the world, but we are also deeply embedded in the global economy and rely on individuals outside of our borders to enable our continued development. We are eager for the day when international travel is once again safely possible, and when we can welcome everyone back to our pristine paradise. Making this future a reality is why this call to action is so important. Just as the virus does not discriminate based on passports, neither should its cure. Palau joins the countries around the world and the WHO in this call to action and affirms that the health technologies being developed in response to the COVID-19 pandemic should be available to everyone. We are already seeing deeply worrying statements that countries that research vaccines and manufacture treatments should be prioritized in access to those health technologies. But where does that leave the smallest of us, who lack this research and manufacturing capabilities? We need instead to turn to global solidarity, especially in this 75th anniversary year of the founding of the United Nations. We need to live up to the vision of the 2030 Agenda for Sustainable Development, to leave no one behind. It is only through this global solidarity and ensuring equitable access to COVID-19 health technologies that we will overcome this pandemic. Thank you very much.
Thanks there to the President of Palau, Tommy Remengesau. Let's hear now from the President of Uruguay, His Excellency Luis Lacalle Pou.
Estimado Presidente Alvarado, le cuento que ando en el norte del país, recorriendo por algún foco importante en la frontera con el Brasil y siempre, y en este caso mucho más, adherir a la propuesta, adherir a la cooperación internacional, adherir a los gobiernos, a los particulares, a los científicos, a los organismos internacionales para la cooperación multilateral. Es muy importante en la salida de esta pandemia, pero también hacia el futuro. Creo que todo esto nos deja una enseñanza, así que, Presidente, por supuesto, desde acá, con el afecto y con el respeto, adherir a esta convocatoria suya. Le mando un abrazo.
Retno Marsudi is the Honourable Minister for Foreign Affairs in Indonesia, and sent us this video.
Your Excellency, the Director General of WHO, Excellencies, ladies and gentlemen. On behalf of the President of the Republic of Indonesia, allow me to begin by conveying Indonesia's appreciation for Costa Rica's initiative on the call to action to ensure global access for medicine and equipment necessary in our fight against COVID-19. The call of action is very timely and addresses a paramount issue to guarantee equitable availability and accessibility of treatment and vaccine for this disease. In this regard, Indonesia supports the call to action in the hope that a voluntary pooling of patents will significantly accelerate the production of COVID-19 medicine and vaccine to meet global demand, particularly for developing and least developed countries. This is the time for us to also rally behind the WHO to be the platform for cooperation among countries in matters concerning public health and to ensure that multilateralism delivers. Upon the discovery of the most effective treatment, medicine and vaccine for COVID-19, it is imperative that we ensure its availability and affordability for people everywhere. Just as COVID-19 does not discriminate between nationalities, race, religion, or economic status, so its remedy must also be accessible to everyone, regardless of their background. I thank you very much.
Retno Marsudi, we thank you. The Honourable Abdullah Amin is the Minister of Health in the Maldives, and sent us this video.
To all colleagues, friends and leaders from like-minded governments, to heads of WHO and other relevant multilateral institutions, to our partners belonging to the scientific, pharmaceutical and medical technology community, and to all and everyone who believes in global solidarity to safeguard human dignity and well-being. COVID-19 has taught us how interconnected and interdependent we are, how vulnerable and ill-prepared most countries are in the face of a public health pandemic, a pandemic that rages on for months, damaging not only our general health and exposing the weaknesses in our health systems, but draining our resources and crippling the global economy, which inevitably would have enduring socio-economic impacts across and within countries and communities. While no country has been spared from the effect of COVID-19, some countries are worse affected than others, and the challenges of overcoming this calamity is equally daunting to such nations. At this critical juncture, a historical moment in human history, when humanity itself is at stake, the world has an historic opportunity to come together in global solidarity to overcome a global threat. Solidarity in ensuring that all persons have human dignity and are ensured basic human rights, including the right to health care on the basis of equity and equality. In respect of global principles and commitments, when a treatment or vaccine for COVID-19 is developed, some countries or communities should not be left behind or too far behind. We are all equal and belong to one world, one humanity. Maldives applauds this timely initiative by the President and Government of Costa Rica and supported by the WHO. As individual nations continue fighting the disease locally, the global battle against COVID-19 pandemic can only be won only by realizing equitable global access to COVID-19 health technologies through sharing of knowledge, intellectual property and data. Therefore, I, on behalf of the Government of Maldives, wish to join other like-minded nations and endorse the solidarity call to action on COVID-19. I am sure with global solidarity and shared vision and shared resources, we would be able to overcome this calamity. With global solidarity and when all nations join hands, humanity will always triumph.
Abdullah Amin, thank you very much. We move away now from heads of state and honourable ministers, and we hear from Michelle Bachelet, who is the UN High Commissioner for Human Rights.
Excellencies, distinguished delegates, ladies and gentlemen, it is my pleasure to join you all in launching this call to action on a very important issue for us, especially today, ensuring that everyone has equal access to medicines and health technologies to prevent, detect, and treat COVID-19. The arrival of this pandemic transformed the world and our way of living in the space of a few short weeks. The impact of both the outbreak and the measures adopted in response to it have highlighted stark societal inequalities and their impact on our opportunities in life, our ability to thrive, and all of our human rights, including health. Even before we were confronted with COVID-19, access to healthcare, medicines, and health technologies was uneven, with deprivation depending on whether one was poor, susceptible to discrimination, or living in other situations of marginalization. The pandemic has only broadened these disparities, and we must act now to change this harmful dynamic that robs so many of their life and health. Excellencies, distinguished delegates, ladies and gentlemen, we all recognize the imperative to build back better, and it is here that our partnership as actors in government, civil society, the United Nations system, the private sector and others has the opportunity to come into its own. Each of us holds one or several of the keys to unlocking access to medicines and health technologies for all. Some hold the keys to law and policy, others to research, development and innovation, and still others to affordability. Our human rights values, among them the rights to life, health, and to enjoy the benefits of scientific progress and its applications, equality and non-discrimination, can help us to navigate this configuration of collective responsibility. The benefits of scientific progress, especially as they apply to life-saving innovations, were always meant to be shared. At no time has it been more urgent to work towards this goal. If not rapidly brought under control, the COVID-19 pandemic will continue to devastate livelihoods, businesses, and economies, affecting all of us in some way. So let us join forces to exchange data and information, accelerate technology transfer, and expand the availability of medicines and health technologies. Let us all do our part and let us do it well.
Michelle Bachelet, for us there. Let's hear now from Jagan Chapagain, who is the Secretary General of the IFRC, the International Federation of the Red Cross.
The International Federation of Red Cross and Red Crescent Societies is fully committed to this call to action. We join the call to assure equitable global access to new COVID-19 essential health technologies, starting from the most vulnerable populations in the most difficult and fragile context. Developing technologies, be it vaccines, drugs, or diagnostics, is a first important step. Ensuring fair allocation across countries and timely delivery to all in need, especially the most vulnerable, will be the greatest challenge. The time to prioritize equity is now. Prioritizing equity means putting the most disadvantaged communities at the center of our collective response to COVID-19 pandemic. Fair and equitable allocation and distribution will require an effective and inclusive engagement of the communities in the entire life cycle of this mammoth process. Therefore, one of the key priorities should be the meaningful participation of the organizations with deep roots in the communities and the communities themselves at every stage to promote the acceleration of global scientific research into COVID-19 prevention, detection, treatment, and care. The IFRC, through its 192 member Red Cross and Red Crescent societies, with their network of 14 million volunteers, are providing life-saving services and essential assistance across the world. Community health workers, including Red Cross and Red Crescent volunteers, represent a sustainable, trusted, and critical resource in delivering healthcare services. Together with communities and health service providers, they join efforts for better health, prevent diseases, raise awareness, and reach out the most vulnerable and outreach populations with concrete actions. During the current pandemic, they are listening and responding to the needs of the most vulnerable groups, helping to mitigate the direct and indirect health consequences of COVID-19, as well as its social and economic impact. As we gather today to call for fairness and equity, we offer our large community network of volunteers and our global presence in support of the call to action to continue protecting every single person from the dramatic impact of COVID-19 and ensure that we leave no one behind. The power of our common humanity is and will be measured by how we collectively protect the weakest among us. Thank you.
Again, thank you very much. Shannon Hayder is the Deputy Executive Director of UNAIDS.
I'm Shannon Hayder, and I'm the Deputy Executive Director at UNAIDS. Humanity today, in all its fragility, is searching for an effective and safe vaccine against COVID-19. It's our best hope of putting a stop to the painful global pandemic. UNAIDS called on health ministers at the World Health Assembly last week to rally behind the idea of a people's vaccine. And we support the solidarity call to action to establish a global pool of products for health to prevent, diagnose, and treat COVID-19. The solidarity call promotes the sharing of knowledge, of data, and intellectual property on COVID-19 to drive the most rapid development and just distribution of all technologies designed to detect, prevent, and treat the virus. It ensures that those technologies can't be monopolized or hoarded or otherwise restricted from reaching the people who need them most. Just like healthcare, a coronavirus vaccine cannot be a privilege. It must be a right for all to be shared and a shared investment in our common safety and well-being. Thank you.
Shannon Hayder, thanks very much indeed. We're now going to hear from Paul Fellner.
Fellner, President and CEO of Revision Therapeutics, and I'm grateful for the chance to support the Solidarity Call to Action for a COVID-19 technology pool. In addition to public good and human rights, information sharing accelerates progress and reduces cost, factors that should motivate investors to support the COVID-19 technology pool. The largest company and even the largest country can only create and know a fraction of available information. Accordingly, in an information sharing environment, each contribution of information yields multiples, not mere percentages, of information dividends. A study of 100 patients becomes a study of 10,000. A single regulatory dossier can benefit from the experience of 10 others, and the next one from 11. Manufacturing can quickly scale globally from one center. This amplification of benefit should be incentive enough, if not for researchers, for their funders who seek to maximize the value of every dollar of investment. Secrecy of data, regulatory dossiers, and manufacturing processes may confer a profitable competitive advantage to the owner of that information in usual circumstances. We're not in usual circumstances. The economic cost of COVID-19 far outweighs any individual benefit. The global economic consequences the world has already experienced from COVID-19 should convince everyone to prioritize speed, including information sharing. The COVID-19 Therapeutics Accelerator, a consortium of 15 multinational pharmaceutical companies and the Gates Foundation, offers compelling evidence that even commercial entities recognize that collaboration means speed.
We turn now to Richard Wilder, who is the General Counsel and Director of Business Development with CEPI.
For epidemic preparedness innovations, the opportunity to speak on the solidarity call to action to realize equitable global access to COVID-19 technologies. CEPI is wholly committed to equitable access to the vaccines we fund, and the opening lines from the call to action resonate with us. The single most important priority of the global community is to stop the COVID-19 pandemic in its tracks, to halt its rapid transmission and reverse the trend of consequential global distress. We know that this goal is only achievable when everyone everywhere can access the health technologies they need for COVID-19 detection, prevention, treatment, and response. Again, this resonates strongly with CEPI and is in accordance with how we manage the COVID-19 vaccine projects we are funding. Speed, scale, and fair access are our central driving objectives. The call to action urges actors involved in this work to take specific action. To that end, let me tell you what CEPI is doing. First, we believe there is strength in numbers when it comes to the scientific process. The scientific community working on COVID-19 interventions can advance more rapidly if what we are learning is shared broadly, rapidly, and openly. In our agreements, we require our awardees to rapidly disseminate project results, such as assays and standards, animal models, or correlates of protection, share project data with the broader community, publicly disclose clinical trial data, and publish the results of the research under open access principles. Second, we ensure access to the vaccines that result from our funding through our funding agreements. Consistent with the call to action, our agreements specify that the vaccines produced must be affordable, available, and accessible to all that need them. These agreements specify how these obligations will be met, including, of course, any necessary intellectual property licensing arrangements. Third, we are a committed partner in the Access to COVID-19 Tools Accelerator. The vaccine pillar includes CEPI, Gavi, and the WHO as implementing partners. We're working with those partners to design a global allocation and procurement mechanism which will deliver equitable access to the vaccine's CEPI funds. Our agreements explicitly enable the obligations on access to flow into those procurement and allocation mechanisms in the ACT Accelerator. We're glad to be able to join with so many dedicated organizations, researchers, and companies to meet the challenge of the COVID-19 pandemic. Only by being inclusive, being open to finding solutions, and working together towards the common goal articulated in the call to action will we succeed. Thank you very much.
Richard Wilder there. And finally, from the videos, let's hear from Hanan Sboul, the chair of the International Generic and Biosimilar Medicines Association, otherwise known as IGBA.
The International Generic and Biosimilar Medicines Association, IGBA, invites generic and biosimilar medicines manufacturers to actively engage and commit to contributing to the global manufacturing capacity once an existing or newly discovered therapeutic is proven to be effective against COVID-19. As stipulated by this unique and time-limited new health technology pool, sharing of open relevant technologies, knowledge, IP, and data on a voluntary basis will facilitate their use in research and development and will mobilize and expand additional manufacturing capacity since effective technology transfers and early access to key technologies would be permitted. This should be complemented by a clear policy action by WHO member states to plan for future need in full transparency and cooperation with the pharmaceutical industry, both right holders and licensees where applicable. A framework will be provided, allowing generic and biosimilar medicines manufacturers to actively contribute to the global manufacturing capacity by utilizing their know-how and expertise to produce and distribute generic and biosimilar versions of patented medicines at a global level. The licenses will also provide the freedom to develop new treatments such as fixed-dose combinations and special formulations for children. Competition will also help to bring prices down and accelerate access to COVID-19 treatments and help to overcome this global pandemic. Thank you.
Well, as I mentioned before, that is the end of all of the videos. We've, of course, heard from so many heads of state and from members of the public have been getting in contact, those of you who are watching online at the moment. And thank you for that. But my chance now really just to wrap up. This has, of course, been the launch of this landmark COVID-19 technology access pool, otherwise known as CTAP. We've, as I've said, heard from heads of state. We've also heard from so many representatives from the world of academia, from industry, civil society as well, international partners to WHO, and my big thanks to all of you who have stayed around on the call and who have answered so many of my questions and questions from the public and the media as well as we've gone through this landmark launch. I would also like to express huge thanks from WHO to its partner in this initiative, and that is, of course, President Alvarado of Costa Rica. So, Your Excellency, I know you've been also sticking around and listening to all the contributors on this call. Our huge thanks to you, and thank you for coming up with this initiative, and we wish you well with seeing it through as well. That's just for me now to say thank you to everyone for watching. I'm sure you can watch back this discussion online as well on the various formats, and for now, have a very good evening from London.
Thank you.